discussing preparation of posterior teeth for full crowns. So we begin with occlusal reduction and interproximal reduction. This is a 33 carbide burr, which is 2 millimeters long. So I'm first cutting through the interproximal area with that burr, being very careful not to touch the adjacent tooth. Next, I'm cutting depth cuts in the occlusal surface, not quite the length of the burr. Remember, the burr is 2 millimeters long, so I want my occlusal reduction to be approximately 1.5 millimeters. Removing any old mercury amalgam fillings. I'm also cutting off an old leaky crown on the first molar tooth. I cut the porcelain part with a coarse barrel diamond, and I cut the metal part of an old crown with the 33 carbide burr. Just making a cut all the way through the metal and the porcelain from the facial to the lingual or the palatal margin. Using a rubber dam makes everything so much easier. It's a real stress reducer in addition to being very good for the patient. Now I'm using an elevator to separate the crown pieces, which comes right off. This is an occlusal reduction burr, and I'm cutting to the extent of the depth cuts made with the 33 carbide burr. I'm trying to maintain the overall anatomy of the occlusal surface of the teeth. I'm beginning my facial preparation, and this can be done with either a coarse barrel or coarse football diamond. Now I'm removing the old amalgams in high water and high suction. Some people question whether you should remove those old amalgams. I always do, just to be absolutely sure that there's no decay underneath them. Then refining my tooth preparation with that coarse barrel diamond. Depending on what type crown you'll be placing, you'll reduce the facial and the lingual and the interproximal surfaces of the teeth anywhere from 1 millimeter to 1.5 millimeters. You want to be sure to round all line angles. You don't want any square or sharp line angles in the preparation. And I'm going to prep right down to the gingival margin with the coarse barrel diamond. You want to be sure that everything draws. If you've removed those amalgams, most of the time the apical part of the preparation is wider than the occlusal part. So it's very important that you flare those so the crown will draw. You'll use both a fine chamfer and a medium chamfer diamond to place the margins. Now in the facial, I use a medium chamfer. Interproximally, I use a fine chamfer. And I'm extending the margins about 1 millimeter to 1.5 millimeters subgingivally. Use lots of water if possible, and this helps prevent irritation of the gingival tissue. It's interesting that a chamfer margin is the preferred marginal preparation by most laboratory technicians. There was a time we tried to place shoulder margins for porcelain to metal crowns. This is a good margin, but it's very difficult to cut, and you often end up with a wave or a wing on the facial dimension of the preparation at the margin. So a chamfer margin is much easier to cut. These crowns are going to be Emax, so this is the preferred preparation certainly for that crown type. One direction the burr cuts more aggressively, and the other direction is more of a polishing direction. So I do most of my marginal preparation in the polishing direction with the handpiece and the burr. In this case, it's counterclockwise. I'm constantly viewing my preparations with a large mouth mirror to be sure everything draws, that there are no undercuts. Now I'm rounding all the line angles. This is very important. You don't want any sharp line angles. Little final polishing of the incisal-facial line angle. And there you have tooth preparation for full crowns of posterior teeth.
Thank you all so much for joining us this week on the Dental Minute. Make sure you subscribe, and we'll see you next week where we will be talking about prepping lower veneers.